All right, y'all. So this message is being brought to you because in so many situations, especially as a professional, I have seen people take advantage of folks, okay? And I want to make sure in this season you are not taken advantage of. So some of the things that we are going to cover today is on Medicare, some Medicaid things, and I'm going to talk to you again from a professional standpoint. I give you advice based upon what I know, not what I'm assuming. Okay, so I'm not a lawyer. I don't give legal advice. This is not to give you legal advice. This is giving professional advice from a professional within this field. Okay, I have licenses in many different states, so I'm able to advise you, from all over and all spectrums. But this is going to be a more general one. All right, because we have a lot of people that we know who are either older, elderly, or disabled, and these people are underserved. This is a really underserved community, and the caregivers are not even knowledgeable about what's really taking place. So in between, people are spending unnecessary money. You got people trying to take advantage of you based upon your ignorance, like I ain't go to school for that, or I don't have a trade in that. So this is my contribution to you, and I don't want nothing from y'all. Per usual, I ain't giving my number out so you can call me on this. No, I'm not looking to get new clients or anything else. I'm simply wanting to give you this advice. I do a plethora of things, but we're honing into Medicare in this season because we are rolling around to our annual enrollment period. And for short, that's AEP. You guys have already begun to see all of the infomercials telling you call in, we can get you a $3,500 food card. And just by the way, I ain't seen that yet, and I've been in this field for quite some time. So just as a little bit about me, I got into the insurance industry about 10 years ago, and I've been going kind of with that ever since. So I have licenses in various other fields, but I really, like I said, want to talk to you all about Medicare. Now, some of you all know that Medicare is for quote unquote older people, right? But there are other people who are not just older who are on Medicare. So Medicare is also for people who have had a disability for 24 months, and then in the 25th month they will become eligible for Medicare. Now, Medicare is a federal funded kind of assistance program. All right, we have Medicare Part A, Part B, and Part D. Your Part A is going to take care of, kind of like your inpatient hospitalizations, different things like that. Part B is going to take care of your doctors and different services. And then your Part D is for prescription drugs. All right. Now, Medicare in the original form was never meant to be, have by itself. You got a lot of gaps within Medicare. You're going to spend a pretty penny if your people are only on original Medicare. This is why we have plans such as Medicare supplement plans that come in to fill in the gap. And y'all are familiar with car insurance, right? We get gap coverage. So whatever gaps we have within our coverage, that comes in and fulfill that. Well, Medicare supplement plans work similarly. You pay a premium per month, and then you're able to have those supplemented. Typically, they will not have, co-pays on going to doctors and different things like that, depending on the plans that you got. All right. Now, when it comes to Medicare Advantage plans, and this is what most people who are in what they would call underprivileged communities will have. This is known as Part C. It's like a combo. All right. So it includes your Medicare Part A and your Part B and your Part D. These are Medicare Advantage prescription drug plans. Now, that's a lot in one, right? Just know that your C provides you with all the benefits that your Medicare A and B don't provide. Now, you already know original Medicare ain't about to give you no dental, vision, hearing. You like, my mama got Medicare, but she can't get her dentures. She can't go see an eye doctor. She needs hearing aids, but can't get any of that. Well, that Medicare Advantage prescription drug plan is going to include all of that plus her prescription, okay? Now, when we talk about these things, I'm telling you this because you got a lot of people in this season who are hawking older people, their power of attorneys and different things like that to get them to do business with them in this season. And there's people who have gone and got these licenses, and these people are frauds. A lot of people in the insurance industry are frauds, and this is coming from a licensed agent. I'm just telling you, I've seen people do some of the most heinous things to older people, and I say, man, God is going to get you. You doing all of this for a commission, and the commissions are fat. There's some good money in this industry. But you have to understand that there are a lot of people who don't have integrity. That's why this message is coming forth. Now, again, on Medicare, in the original form, what we need to know, like I said, it was never intended for you to have that just by itself. Why? Because there's a lot of gaps. Let's say your daddy go and he falls and he got to get admitted into the hospital. Well, there's a $1,600 deductible per occurrence. That means daddy fall and 64 days later got to get readmitted to the hospital. Even if it's related to the same thing, he has to pay that $1,600 again. That's a lot of money. People was going crazy over $1,200 stimulus check. So you don't want to have to spend that. Now, this is what we get into that Medicare Advantage prescription drug plans, in which a lot of people have and are signing up for. And we need to know how to maneuver within the parameters. We can't stop, what costs people have to pay or are associated with, but we can put a buffer on it. And that's what I'm educating you guys on today. So when you come to this Medicare Advantage prescription drug plans, these were meant to help you have a limit on how much you would have to pay when you are in any situation. All right. Now, these work more similar to when we are under the age of 65 and we have coverage through our jobs. Humana, Aetna, WellCare, all of these different, big names, Blue Cross Blue Shield. These are private insurance companies that elderly people can get these coverages through. Now, a lot of times it's going to be $0 as a premium for these people. Sometimes they come with a premium, just depending on, right? But as long as they have Medicare Part A and B, they can qualify for what we call the C. All right. And this is something that y'all may want to take notes so that you understand. But I'm just giving you kind of like some free game. So when y'all get on the phone with people, you know how to kind of do. Now, with these Medicare Advantage prescription drug plans, these are the plans that will say if you go to having inpatient hospitalizations for days 1 through 5, this is the copay. This is the copay. You have an expectation of what you're going to be paying before you even go in. If you go to urgent care, or if you have an emergency room visit, emergency room may be $90, urgent care may be $30 or $40, some things like that, so you can understand how to maneuver and work within your Medicare options. All right. Now, with that being said, you also get additional benefits. Now, these plans will come with your vision, your dental, your hearing for the most part. All of this is going to go by your zip code. Now, if you're talking to somebody in Florida and they say, yeah, I got me a Part B reduction or Part B give back, which means that they're giving you back money on paying your Part B, in which most people pay about $164 for Part B. Now, if that's the case, it don't mean that in Tennessee you're going to get that same thing, because all plans differ from zip codes, okay? And it goes by your county. You can be in the same state, different county. You may not be able to get what Emma Jean get. You may have to get something a little bit different based upon where you are. So this is just some backstories, okay? Now, with that being said, sometimes people will say, hey, I'm calling because I want, that $3,500 card. I like my coverage, what I got right now, but I want that card because I need some additional food. Well, those services that people telling you on these infomercials, I'm going to be the first to bust your butt. But when you call these places, they are not isolated. These things come as a package plan. So they have to already be built into a plan in order for you to get. So I don't want you to think you calling somebody and say, they lying to me because this person told me on the TV. No, in some places they may be, but it will always be attached to a specific plan, okay? Now, just to brief you, when you call and get these plans, there's some information that you got to be able to give. Some people do not have their things in order, and y'all got to get y'all stuff in order, because this be the biggest thing. You want something, but you ain't got it in order. MBI, that's your Medicare beneficiary information. What does that mean? That red, white, and blue card that they sent out to you got about a 9-digit code and be a series of letters and numbers. You're going to have to read that back to somebody who's trying to help you see what you qualify for or what you're eligible for, right? You need that information. If not, they need your social. I don't give my social, well, you can't get no assistance. That's the first thing that you need to know. Now, do I think you should be giving that information to everybody? No. Because like I said, there's some fraudulent people out here, but you got to give in order to be able to get. That's what we should know. Now, as we talk about Medicare, a lot of our seniors, we are on Medicare and Medicaid, right? So what does that mean? Medicare we establish is from the federal government. Now, Medicaid is a state assistance program. So if you're in Tennessee, it might be TennCare. They may just call it Medicaid in your state. You may be on Medi-Cal if you're in California. So these are state program. So the state would have said, well, you can get extra help in this regard, or you qualify for Medicaid at various different levels, right? Now, if you are dually eligible, you will qualify for what they call dual eligible plans. Now, this is very important for you to know, because if you have a mother, a friend, a sister, or somebody else, they may be qualified for more than what they're getting right now, and y'all are paying buku money out of pocket trying to get the pens, trying to do the basics, and these plans are coming fully equipped with that, and you just don't know. So it's important, if you know mama, daddy, or somebody you know, or even your children whom are, disabled, you need to understand what plan they have and what may be open to you all within the county. And that's when you speak to an agent. Now, as all of this comes together, what do we need to know from there? Medicare Part A and Part B, you got to have that, right? Medicare Part A, how do you get it? Most people who have worked their 40 quarters qualify for that, and most people who haven't are going to get it for free because they've already contributed into it. Every time you've worked and they took that Medicare part up off your check, that was your contribution to it. Now, there are some people that will qualify for Medicare Part A and not have worked that 40 quarters. How do you do that? If you've had a spouse who did work their 40 quarters and you've been married to that spouse for 10 years or more, now you can qualify for that, okay? There are some things that you would have to do, but you could qualify for that. Again, most people get it free. Can you get it and you haven't worked the 40 quarters? Absolutely. Now, all of this will go through your Social Security office within your particular state, and then, of course, you would have to go through 1-800-MEDICARE. Now, that's for that. Medicare Part B, most people are paying about $164 as a premium. A lot of people are looking to get Part B give backs. Now, when you go shop for a plan and you say, I want to be able to, I don't want to pay them $164. Well, here's the thing. We can't control that, but maybe we can help you get a plan that'll give you a give back or a reduction. Now, something you should know about that, if you got heavy dental work or other things, you have to give to get. If you get a Part B reduction, the benefits are not going to be as robust when you get into that plan, but at least you'll be seeing that money back. Now, there are some of you who are paying into what they call Medicare supplement plans, maybe for your parents, or your parents have been paying into that for years. Now, my personal deal is that I will not take someone off a Medicare supplement plan who has a Plan F, and it's been coming in handy for them all of these years. I personally won't do that. It's not a good practice. I will not do that for anybody that I know, unless the fact that it has become cumbersome. It's too expensive. Medicare supplement plans are extremely expensive. How can you get these plans? Mutual of Omaha. You can go through all of these Humana, different types of carriers in order to, get those plans. But at the same time, it comes at a pretty penny of a cost. Who should get a Medicare supplement plan? Those who don't want to worry about paying a copayment when they go out. But at the same time, I've seen people paying $400 for a Medicare supplement plan. Then they have to pick up a supplementary dental plan, plus a vision plan, plus a hearing plan. Then they got to have life insurance. So as you can see, people can be out in a year's time of $5,000 just going into their health care and never use it. So right now, this is a time where the world is shifting. Y'all need to get together in a group huddle. Okay, mama, what we doing? Because in the event that something happens to you while you are still living, we need to know that. Now, especially when I say, hey, mama, we talking about this, or hey, dad, what's going on with that? A lot of the times your parents may want you to call on their behalf, but a lot of times you cannot complete enrollments for these people if you are just a witness. That's why having a power of attorney is very, very important. You do not need an attorney to get a power of attorney document signed and make sure that it's just a legal document that you have. A notary can sign off on those things for you. You can pull legal documents from online and everything like this. Again, this is not legal advice. This is telling you how to work within the parameters. So with that being said, if you are trying to call on behalf of your mother, your father, or someone who is not your child and you are the legal parent guardian of, you need a power of attorney. Now, some things are different. Some people, your parents are in good health. They are in their good mind. They can make their decisions. You are just the medical power of attorney. Now, a general power of attorney, just like we even know with real estate or anything else, gives you the opportunity to make decisions for people, whether financial, God forbid something happened to mama, she loses mobility, whatever, you can make financial decisions for her, medical decisions, and all of the above. This is getting your house in order in the kingdom. Now, I don't know why churches ain't sitting people down and talking to folks, because your life while you are living is still very important, okay? Now, these are some things we need to know. For a lot of my veterans, I saw that they had a terrible time during the pandemic. Now, I done told y'all, the Lord spoke to me and said, influence with the capital FLU, meaning flu, 24. There's some things getting ready to happen. Now, my veterans, especially the ones in Mississippi, had a very hard time with getting their VA benefits, going to see their doctors. So a lot of veterans will need civilian doctors as a backup. You may say, well, my dad loves to go to the VA. He gets his prescription drugs there. He's totally happy with that. Great. Great. Well, we may not need to move him off of that, but he may just need what they call a MA, which is a Medicare Advantage plan. Leave the prescription drugs over there with the VA, but he might need an MA so that he can see civilian doctors, so that if anything were to happen and he goes to the hospital, he has things that he can work around with that ramification, because the government and everything is shifting. Y'all heard already that if all of this pay cuts and stuff like that, the first people who are going to be affected is the military. Now, your dad and certain people have gone out, risked their lives, and they are underserved till this day. So these are some of the things we need to know. If your people got TRICARE, if they have railroad coverage, don't have your mom and your daddy them calling them people for additional benefits, because there are some people who are not good agents, who do not practice in good care, and they will take them off of these TRICARE benefits. And we can't get them back on after that. Did you know once you get on, we can't get you, you have to go through a whole grievance process with Medicare. And since all enrollment's got to be done on an inbound call, they're going to fight to say they knew exactly what they were doing. And you're going to have to fight to say, no, they didn't. So this is how we are going to avoid certain things. We are just trying to get ourselves equipped so that we can know we can get the most out of this lifetime. So again, there's some takeaways that we need to know here. There are additional benefits for our seniors. One, you got to be the proper person. And sometimes some carriers, if you are the power of attorney, they will make you send in documentation showcasing that you are the power of attorney, or that enrollment will become null and void, and then that person will be switched back to original Medicare or whatever they did come from. So these are some of the things that we do need to know. Should your people just have original Medicare? From my professional opinion, I would say no. They don't have no dental and vision, so somebody got to pay for that from them. A lot of our seniors are on fixed incomes. Why would I go pay for something that I'm already entitled to? You feel what I'm saying? If I can get $2,000 in dental at minimum, let me go get that. You know, there's some plans out there. Cigna offering $20,000 in dental. If it's available in your zip code, figure that out. There's carriers like United Healthcare who will say, we'll give you $230 in, over-the-counter benefits, work towards your utilities, approve groceries, these different things. And another thing with over-the-counter benefits, some of you guys are, spending money to keep the vitamins stocked for your parents and different things like that. Some of these plans, a lot of these plans are coming with over-the-counter benefits that they get every quarter. Okay, and if you do not use it, you will lose it. Right now, some of your people got plans. Some of your children who are disabled have plans. Get everything out of there. If you have a parent, even with dental, and they're like, wow, this is going to cost so much, but they're at least going to break this out in phases, use the $2,000 this year, knowing that you're going to have that $2,000 that resets on January 1. Get everything you can get out of these plans. Half of the time, our seniors have worked for it. There's just nobody to sit and be patient with them, tell them what they can get. And a lot of times, I know it's frustrating. If you married and you got a husband, or for some men, they have wives, they don't know how to matriculate this system. There's a lot of information out there on Medicare.gov to give you information about. These people get paid to service you. Don't feel like you are a bother when you call Medicare.gov to understand what it is that your people are entitled to. They gonna need that. Now, if mama or daddy got Medicaid as well, the state program, you gonna need your Medicaid number. This is one of the biggest things. Some states will not give out a Medicaid card. You need to get on the phone with Medicaid and say, hey, my mother, my father is a beneficiary. I need to know what their number is, so when they call to enroll in these plans, come annual enrollment period, which by the way is from October 15th to December 7th, they can make as many elections as they would like to within that ramification of that time frame. The last election that they make, December 7th, okay, that's the one they have to stick with. That's what's going into play come January 1. All right, so these are some of the things I need y'all to get together. I don't want us out there just not knowing stuff. The first people when this shift comes that's going to be affected is our babies and our elderly people. I have seen so many babies on Medicare, and it's so grieving. These babies have debilitating diseases, doctors having malpractices, and that's why these children are sometimes in the state. Y'all got to take advantage of your stuff. You got to think. You got to figure out how to outsmart people when they're trying to trap you up. What are you going to do? And a lot of times, the older people will say, well, I've been having this plan forever. It ain't never bothered me before. I don't want to. No, there are some things that you can get that would stop me from paying for. You gonna get yourself into a new plan. Another thing I want to talk to you guys about, because I know sometimes you don't know, HMOs and PPOs, all right? So the perk about original Medicare is that it's gonna travel with you wherever you go. You're in Florida, you go to California, original Medicare is navigating with you. Medicare supplement plans, as long as they take original Medicare, they're going to take your Med Sup plan. Now, something that we should know is that an HMO plan is going to limit you, okay? It's a health maintenance organization. It's going to limit you to only the doctors that you do see. But from my professional experience, I've seen those plans have a lot of benefits that come along with it. So long as your doctor's covered, long as the hospital that you go to covered, a HMO is not a bad plan. Now a PPO, sometimes we have our seniors in, honey, they love to go travel, they love to do everything. They spend 3 months here with your children and then they'll go see your brother and go to another state. That PPO plan, a lot of times gives you a little bit more flexibility to travel with you as well, okay? Some people got 2 homes. They live 6 months within Florida, may spend 6 months in North Carolina. So again, these are the things that we need to be thinking about. We can't stop what they're doing, but we can work within the parameters and make the system work for us. So I come to you all with a lot of spiritual information, but we live on this realm right here. We need to know how to protect ourselves, how to equip ourselves. We saw what happened within the pandemic and how elderly people, particularly those who were institutionalized, were dropping like flies. A lot of time when your people are in an institution, when they are in these elderly facilities, there's a lot of neglect that goes on there. There's a heck of a lot of neglect that goes on there. And it sometimes seems like they take your power. They seem to take your power. You were once able to go take your dad or your mom out for a walk, but as things shut down with the government, certain things are beginning to be restricted for you. A lot of times, any type of benefits that they would get now go straight there. You're feeling like, what should I do? You're going to have to work with the coordinators there. You're going to have to plead your case. You're going to have to step up, talk to people, understand what is my mom taking? No, she's starting to feel weak since she started taking that. So now we need to figure out other things. A lot of times, and this is something that I want to tell you, they're trying to drive older people crazy too. They are. And I'm going to tell you, it never was a qualification that you had to read mental health services to older people. Now CMS with Medicare is cracking down on that. Now we need to tell older people how much it will be for an inpatient stay, how much for group therapy, how much for individual therapy. It was a time where only people who had significant money could afford that stuff. This stuff is being built into plans, and this is all strategy. Are you catching what I'm saying? This is strategy. I'm not going to be in something and not warn my people. I'm not one of them. I'm going to tell you what's out there. So this is a time, if your people got a plan, if they're on a Medicare supplement plan, but your mother or your father is struggling to pay that, we need to sit down now. What are we up against? No, maybe you can be up $5,000 for the year by cutting off that plan and switching from a Medicare Sup to a Medicare Advantage. You haven't been sick in the last 8 years. Only thing you do is your routines and you've been fine. If that be the case, then we need to start making some provisions to keep what's in our safe. So this is me just coming to you guys with my team. We're all licensed in so many different arenas, and I just want to be able to share this knowledge with you and put that out there for you. So again, you can educate yourself from what is online. When you hear infomercials, these things are based on zip codes, based on plans that you are in. They are not just isolated. I hear so many scams about life insurance over the internet. Oh, you can just take this money out your life policy. Not if it has not accrued. Not if it hasn't accrued. So these are, again, things that we need to understand. And on that note, some of your family members have had life insurance policies, and now the church was the beneficiary. that 501c3 was the beneficiary of your mother's policy or your father's policy, which means if something happens, you don't have a say with how all of this goes. These are the things that while your people are in good health, you need to be able to do. If you don't have the power of attorney and your people are already not in good health, what you waiting for? We have to do this now. So this is some of the things I need you to know. If you could be under 65, do not have a beneficiary that's a secondary beneficiary on your policies that you already got with life insurance. This is just a bonus that I want to add into that. Please get one. I knew people who, for example, mom is here, dad was here, they were each other's beneficiary. There was no secondary beneficiary. The money now goes to the estate instead of someone who was listed on the policy. Well, why didn't they just put the child? Well, y'all gonna have to figure out how to get this done, because that money is gonna go to the estate, not an individual, so that they can continue. Remember, these life insurance policies are really working for a lot of people now, because at the same time, you can't keep mom a house if you can't make them payments, pay them taxes. Well, the house paid off, well, the taxes coming every year. I'm in real estate as well. People lose a house, beautiful homes, over not being able to fund them taxes. So again, this is something to think about, estate planning. It's never too young or too old to do estate planning. Think about these things, equip yourself. As this world is shifting and things are going down, God's people are rising, but we have to rise through knowledge. Through knowledge, the just shall be delivered. We are the just, and we will be delivered in this season. I hope you guys enjoyed that information. Any questions that I can't answer in the comments, I will, go ahead and answer that for you. This is not legal advice. This is my professional opinion. I ain't gonna give you my number because you can't call me on that. I got my people and we good with what we have. But I just want to help as much as I can. And please share this information with somebody. You have some of your friends who are genuinely struggling with their parents. Don't want to put them in a home because you don't want them to be neglected. And even on that note, you could get paid too from some of these plans that they will say if you are the caregiver, they will pay you for your services and your contributions. Some people have really given up the life that they once knew, and it's heavy on you. So there's help for you. There's services that could provide you compensation, but you have to be able to work within those ramifications. I hope you enjoyed the information. I pray this was fruitful to your spirit, and hopefully we just getting higher this season. Love you much. Mwah.